Veins are blood vessels that carry blood to your heart. Venous insufficiency results from decreased blood flow from the veins in the legs to the heart. Veins have one-way valves inside of them to help the blood flow against gravity. When the valves inside the veins do not function properly, blood flows backwards in the veins. This is known as reflux. This causes pooling of blood in the veins or venous insufficiency. Varicose veins are large, thick, bulging veins in which the valves do not function properly. When valves within the veins fail to work properly, there is a blockage to normal flow, or the calf muscles cannot pump properly. Blood can flow backwards in the veins and pool in the legs. The pooled blood can increase pressure in the veins. Risk factors for venous insufficiency include aging, family history, the female gender, pregnancy, obesity, and history of DVT. Symptoms for venous insufficiency include varicose veins, legs that ache, tired legs, heaviness, swollen legs, restless legs, darkening of the skin, leg ulcers, symptoms that are worsened with prolonged standing, and symptoms that are better with leg elevation. A duplex ultrasound or Doppler is used to map out the veins in your legs and to track the blood flow. It is a painless, non-invasive test. Varicose veins and venous insufficiency is treated with leg elevation, exercise, compression stockings or compression bandages, vein ablation, and sclerotherapy. Simply elevating the legs above the heart level for 30 minutes 3 to 4 times a day can reduce swelling and improve blood flow in the veins. Improving blood flow can speed healing of venous ulcers. To be effective, is it important to elevate the legs above the level of the heart. Simply putting your legs up on a footstool does little to improve drainage of blood from the legs. Foot and ankle exercises are often recommended to reduce symptoms. Pointing the feet down and up several times throughout the day can help move blood from the legs back up to the heart. This may be especially helpful for people who sit or stand for long periods of time. Walking is a good exercise for the calf muscle pump. People with chronic venous disease who walk less than 10 minutes a day have a greater risk for developing venous ulcers compared to those who are more physically active. Compression therapy is an essential treatment for chronic venous disease. People with more severe symptoms such as venous ulcers often need treatment with compression bandages. Compression stockings gently compress the legs and may improve blood flow in the veins by preventing backward flow of blood. Stockings are available in several styles, including knee-high, thigh-high, and pantyhose, with open or closed toes. Using ultrasound guidance, a catheter is inserted into the diseased vein. Using this catheter to apply heat or glue, the vein is sealed from the inside. The vein stays in place, but it no longer carries blood. These procedures involve no surgery and are done in a doctor's office. The closure-fast procedure uses radiofrequency energy or heat to close the diseased vein, which redirects blood flow to healthy veins, relieving symptoms. Using ultrasound, a catheter is positioned into the diseased vein through a small opening in the skin. Lidocaine solution is injected along the vein to anesthetize it. The small catheter then delivers heat to the vein wall, causing it to shrink and the vein to seal closed. Once the diseased vein is closed, blood will reroute itself to other healthy veins. Following the procedure, a simple bandage is placed over the insertion site, and additional compression is provided to aid healing. You will be encouraged to walk and to refrain from strenuous exercise for 1 week. The Venous Seal system delivers a small amount of specially formulated medical adhesive to seal or close the diseased vein, rerouting blood to nearby healthy veins, which provides symptom relief. Venous Seal adhesive is placed in a vein via small catheter. A bandage is then applied to cover the wound. For this procedure, a chemical is injected into the diseased vein that causes it to collapse on itself. The vein stays in place but no longer carries blood. Sclerotherapy is done in a doctor's office. Verithina Sclerotherapy is a minimally invasive, non-surgical injection of medication which does not require any incisions or anesthesia. A small amount of Verithina is injected through a catheter or by direct injection into the malfunctioning vein. The Verithina microfoam fills and treats the desired section of the vein, which causes it to collapse, and the microfoam is deactivated. When the malfunctioning vein collapses, blood flow shifts to healthier veins nearby.